How to Treat Cervicogenic Dizziness with the Physio Blend by Dr. Harrison Vaughan and Dr. Danielle Vaughan. I am going to take you through the highlights of our newest book on how to treat cervicogenic dizziness. Our book is broken down into 24 chapters, starting about the authors and how we are the orthopedic and vestibular specialists within the field of physical therapy to help write this book. And then we break it down, and today's highlights are going to just show these different chapters on the effective treatments of cervicogenic dizziness through manual therapy, exercise therapy, vestibular therapy, and sensorimotor therapy. Our first chapter basically goes through what is cervicogenic dizziness, how is it diagnosed, and then who can appropriately treat it. As we go through the chapters, our next chapter, chapter 2, talks about the pathophysiological processes on what goes on to why the cervical spine can be a component of dizziness. Our third chapter goes into more depth of the pathophysiological hypothesis associated with what are the mechanisms within the cervical spine that can be the reason of why you have dizziness. Our fourth chapter begins what we call the bottom-up strategy of how to treat cervicogenic dizziness. Our fifth chapter describes the different types of physical therapy interventions and which interventions should be chosen and the literature behind why and when to choose them. Chapter 5 ends with the description of how we are going to effectively treat cervicogenic dizziness through the Physio Blend. The remaining chapters are going to take you through the oscillatory and sustained mobilizations, through manipulations, signature soft tissue approaches, pain relieving exercises, sensorimotor and vestibular rehabilitation to ultimately have the best of the best in regards to manual therapy and exercise to treat individuals with cervicogenic dizziness. Chapter 6 starts off with treatments to the C2, C3 segment with our combined lever mobilization. Chapter 7 goes a little bit more north to the C0, C1 segment through our subcranial distraction. Chapter 8 describes how to effectively treat the upper, middle, and lower thoracic spine in terms of a manipulation technique. Chapter 9 takes us through different types of pain relieving exercises of the C1, C2 segments of the upper cervical spine and the related evidence associated with this. Chapter 10 discusses the first part of our soft tissue or non-articular components with the soft tissue review. We discuss different types of acupuncture points in relation to the soft tissue points, the anatomical and biomechanical reasons of why these muscles are of interest. We have a nice schematic of a cross-section analysis of the muscles at the occiput level and really break down why each one of these muscles is effective in treatment manually for cervicogenic dizziness. Chapter 11 talks about ischemic compression and a procedure that majority of practitioners can utilize on these soft tissue points. Chapter 12 begins some of the manual therapy, including suboccipital releases. Chapter 13 discusses how to effectively treat the sternocleidomastoid muscle. Chapter 14 continues along the soft tissue work to discuss how to treat the epicranial aponeurosis or Gallia aponeurotica, the longissimus capitis, splenius capitis, sternocleidomastoid fascial point, and the semispinalis capitis muscle. Chapter 15 goes a little bit further down the cervical spine to show you how to effectively desensitize the segments from C4 to C7. Chapter 16 starts the therapeutic exercise program discussing cervical motor function, including deep cervical and deep flexor muscles, including low and high threshold exercises. Chapter 17 describes these different techniques and how you actually train individuals how to do it effectively, such as the cranial cervical flexion neuromuscular reeducation, the deep cervical extension neuromuscular reeducation, and the semispinalis cervicis isolation reeducation technique. Moving forward, we discuss in Chapter 18 the postural reflexes, and this gives you a breakdown of how they relate the rehabilitation of the cervical impaired dizzy patient, combining both the cervical and orthopedic world to the vestibular world by discussing the vestibular ocular reflex, the vestibular colic reflex, the cervical colic reflex, and the cervical ocular reflex. Chapter 19 is the beginning of our vestibular rehabilitation approaches, discussing the cervical impaired dizzy patient, including providing an entire patient review of why this is important in treating your dizzy patient, and knowing how to effectively examine and treat the upper cervical spine, including modified canalith repositioning procedures for the cervical impaired dizzy patient. Chapter 20 continues vestibular rehabilitation by giving you the evidence to should you treat vestibular rehabilitation for those with cervicogenic dizziness by just doing vestibular therapy only, combining manual therapy with vestibular therapy for both the single and double entity diagnosis. Chapter 21 takes us through a lot more techniques specifically for vestibular rehabilitation through smooth pursuits, saccades, convergence, divergence, and VOR1 and VOR2 exercises. Chapter 22 talks the initial aspects of balance training and how postural control is necessary to effectively treat someone with cervicogenic dizziness. We carry on to Chapter 23, discussing our sensorimotor rehabilitation program. This chapter discusses how sensory reweighting would be perfect for these individuals, the emergent evidence of the sensorimotor rehabilitation, and then exercise prescription programs. Chapter 24 continues along sensorimotor therapy by showing you different techniques, such as head relocation or cervical positioning retraining, cervical movement sensory training using different types of diagrams and patterns, such as figure 8 patterns and Z patterns, and then modifications of above frameworks for those with cervical impaired patients. The end of the book discusses the surgical options. These are invasive options from the medical literature, a short review of different literature of how we can potentially refer out to our colleagues in the orthopedic or neurological world to help individuals if we do not get them better. All this is backed by clinical experience of over 15 years each. Plus, the back of the book provides over 300 references on our approach that we call the Physio Blend. Hope you enjoy the book.